Welcome to Journey Through the Eyes, EMDR podcast. This is the podcast that is here to unveil and explore the transformative power of EMDR therapy. Our mission here is to support both the new and seasoned clinicians in the critical conversations, resources, all about EMDR and how to build your amazing private practice. I'm one of your hosts, Tamara J. Brown, licensed professional counselor and MDRIA certified therapist. I'm so proud to say that. And I have with me my amazing co-host, Miss Kathy on the couch.
Hi, I am Kathy Couch. I am out here in Twin Falls, Idaho. I am so thrilled today to be with Stephanie and Tamira. They're part of the very first cohort of our EMDR University program. I just have such an affinity for them both. Stephanie's a certified thanatologist and EMDR therapist, and she lives in the Pocono in Pennsylvania, in Poconos in Pennsylvania, and she's just an excellent human being, and we've been able to collaborate on trainings and grief and loss, and she's an expert in sibling loss, and her training's coming up in July, and we will post a link on how to register for that today. And we do lots of fun trainings together. We are going to have a continuing bonds training on September 13th, and just be looking for that. So we are so happy to have her here today. Also, at Rewired 360, we just launched our app this week.
Yay.
Yay!
Yay.
So we are so excited for our listening audience. Go ahead and download that app, and we can get you on the go, on demand. And so lots of fun things are happening, and we're so excited to be here. So I'll kind of turn it over to Stephanie.
Thank you for that nice introduction. I'm
course.
Stephanie Pearce, and like Kathy said, I'm based in the Pocono, PA area. I specialize in reproductive and maternal mental health, and then loss through the lifespan. And then I recently started trainings and educating people on sibling loss.
So I guess, Stephanie, where to start? Could you walk us through, let's talk about how you were EMDR trained and your journey there. And then I'd also like to hear about your certified thanatology journey. Mine was because I had a colleague that was certified through the Association of Death Education and Counseling. And so I became a specialist. If I was going to pursue grief and loss, that means that I specialize in death, dying, and bereavement. So to find one of me on the other coast was super exciting. So I'm just curious about those credentials and how you came to be certified in both of those.
Mm-hmm. So my EMDR journey was, I actually wanted to become EMDR trained like at 10 plus years ago, or probably longer than that. And my agency at the time originally said that they would pay for it and support the time to be able to do the training. But then that fell through. So something I regret not doing then, but my funding kind of fell through then. So it actually was, for me, it became a pandemic project to be trained. So I actually had the funds and the time then to make the commitment to be EMDR trained. And so I want to say I was apprehensive about EMDR training at first, and wondering how it was going to fit into knowing the importance of it, but wondering how it was going to fit into like this managed care, insurance driven private practice model that I do have, because most of my clients have insurance, and I'm an insurance provider, and I get paid that way. But so apprehension.
Were you already in private practice at that time?
Yeah. So I was wondering how it would fit into that model, though. And so apprehension, and then even my first day of basic training, I just fell in love with EMDR then, and it felt like familiar and comfortable, even though like that was my first real exposure to it, though. So I did my basic training, and then I just fell in love with EMDR just for actually like observing in getting the felt sense of how you really, instead of giving people tools in session, it really heals them, and you get to observe that is just like lovely between you and your client, and that clients are open to doing that. But I didn't realize at the time that like EMDR can become a career and you can be part of a community. So I really liked like for EMDR Rewired 360 that like that you provide that education, like, oh, this you can be part of a community now. Like this could be a journey. This is a career path. So I really like how that opened up for me then. So that's a long answer to that part of the question.
That's great, exactly what we were looking for. Could you share about, were you already a thanatologist when you started your EMDR training, and how did that all come up for you?
I was not when I started my EMDR training, but I took a lot of like David Kessler trainings and PESI trainings and a lot in grief and loss. And at the time, I didn't think I had enough like of like credits and what.
Oh, that's why you always say to people, check your CE, because you might, oh, okay, now I understand.
Yeah, I didn't think I was like, oh, I probably didn't that mentality do enough to have what I needed. And then I did have a colleague who was like, who was a certified thanatologist and who said, you probably have more than what you need. And she kind of like mentored me and encouraged me to like look and see if you do have what you need, because you probably only have to take the test. And she was right. Like I had all the clinical hours, the CE hours, and then I had, and I'm minimizing sitting for the exam because there was a lot of prep. But like that person just motivated me. And I think to get to be a thanatologist, it shows people just like being a certified EMDR therapist that you did the work, like you want to elevate yourself. You're showing you have the experience.
I think the difference also, so for those our listening audience, what a thanatologist is we have 6 categories. Hopefully I can list them all. Traumatic death, death education, grief, loss and mourning, assessment and caregiving, um, end of life decision making and dying. Boom, did it, yay! And so if you're joining our free grief and loss webinars, that's the topic. So I think for me, when I was looking at those topics and studying, because it is a very difficult exam, I think what drew me to that was also like the CEs, which you can use your EMDR training to qualify for the CEs. And any suicide trainings or any other kind of death related trainings will also qualify you. And I think for me in those areas, I like the Association of Death Education and Counseling's certification because I can identify in a professional way in a field of study thanatology versus other certification programs. This is a commitment to a body of knowledge and learning versus sort of just being certified. And so I think for me, it feels good to call myself a thanatologist. Nobody really kind of, it's kind of an obscure word sometimes, but I think that's really important to me. And if you're considering doing that, I would, consider, do you want a more extensive training and a body of knowledge and ongoing, or would you just like to be certified? How do you feel about comparing and contrasting sort of Association of Death Education and Counseling with other ways to be a certified grief therapist?
Well, I think, like you said, and I want to say I want to acknowledge you taught me even how to say thanatology by saying think Thanos, because I like trip over that word when people are like, what's a CT? And I'm like tripping over the word. So thank you for teaching me actually how to say thanatology, because it
Yes.
was a tongue twister before. But I agree with you that it's like the certified thanatologist, it's different because it shows like you have this complete knowledge base then on different areas, not just on bereavement. It's like this, like you have the complete knowledge on like this total like continuum and different areas of grief and loss instead of just on bereavement or the therapy angle. Like it shows that you have knowledge on decision making, planning, death education, and it really that you went above and beyond to obtain this certification too.
Yeah, and I think also what I've been learning, as I adapt my EMDR practices, grief and trauma kind of go hand in hand.
Mhm.
And it just gave me like a foundation, like a identity that was very deep,
Mhm.
within me. And I think it just feels, as I became an EMDR therapist, we were like, what's my niche? And I was like figuring this out all the while doing EMDR and being a thanatologist, trying to figure out what was my niche. And it's like, once I just stopped, I think, Tamara, you can appreciate this, and landed into my identity, then I was like, oh, I can really be this now. It's just more of a clarification. So what I would say to the audience is, you probably already have what you need as far as a professional identity. Just tell people, go back and look at your resume and see what your specialty areas are. So I think that identity development is difficult. I want to talk to your point about Thanos. I was reading that in my books, and it said, thanatology is derived from the Greek word Thanos. And at that time, I was a Marvel nerd, and Thanos was out there. Tamira's a Marvel nerd too. So
Me
that
too.
yeah, Stephanie too, right? So we made that connection, and then it just resonated. So that was a fun moment for me, Stephanie, to have you recognize that.
Ladies, I gotta back the train up because you all are saying some powerful things that for our listening audience, I just want us to lean in just a little bit. And Stephanie, your presence, your wisdom, your heart, I mean, I sense all of that. And I thank you for bringing that forward to today. One of the things I was grateful for Kathy, and you both kind of explained what thanatology is for us folks like myself. I didn't even know that there was a concept or a approach to supporting people who are going through grief and loss. I had no idea till I met Kathy. And so I'm so grateful, right? Because here at Journey Through the Eyes, we are on a powerful mission in helping the therapists to lean into their identity as being healers, those who know that they're chosen to do not just the job of therapy, but go into the actual work and sharpen, right? Learn more, become a student of the healing path. And so that's one of the gifts I think you brought to the table for us today, Stephanie, as therapists, and looking at our career pathway and looking at ways. I loved how you said this. This was delicious. So I may be stealing this from you, but it was powerful. You said that even in your journey of becoming an EMDR therapist, what made you fall in love with it was that you were able, as a therapist,
Mhm.
to not just give clients tools, but to actually heal, help them
Mhm.
to heal.
Mhm.
And I think that that's the incredible part that EMDR brings to the table, and a pathway for those who are interested, or even those who are in EMDR, because it is a big learning curve, right? It's a huge learning curve, but we get to be witnesses, not just of, the traditional therapy of talking and giving tools, but actually leaning into, for many of us, why we became therapists was for the healing, right? I wanted to ask you, um, because that whole idea, right? I know for me, and Kathy has helped me. She may not even know this, but she's helped me with, how do I say, like how we all have our niches. Kathy was talking about. For me, it's a combination between religious trauma and childhood traumas, right? But when you get into the area, I know for me as a clinician, um, dealing and navigating, I don't even want to say dealing, that almost doesn't feel good to me, but navigating the pathway of dealing with loss with clients and knowing how to really support them, you know, is incredible. So it sounds like this thanatology certification really gives you a helicopter view, and then turns the light on, right? Or leads you on a pathway on how you can guide people through that. I just think that that is really incredible, and just wanted to highlight that and share with our listening audience that um, there's more, right? There's more for us. There's more for us to invest in so we can broaden our scope of practice and all the things. And so, how did you discover what was it, Stephanie, that made you or that helped you to realize that, hey, this is I'm passionate about this, what kind of activated that for you that made you say, I want to invest and sharpen my skills and broaden my ability to support? What was that for you?
I think even so, my early career, worked in a family crisis unit. And just like even then, although I didn't realize it then, that because it was like, and I say this both literally and metaphorically, like these families were chair throwing at literally metaphorically at each other. Like it was like where they were at that level of conflict. See that at that time, you don't, when it's so acute, you didn't have time. And I didn't have the knowledge to zoom out then and say, a lot of this is about unhealed trauma and grief. Like, and what's led us to this then, where people are like so angry at each other that they're ready to throw chairs and doing that. And so, and really zooming out and realizing that was what was going on then, and then wanting to say, how do we get to that deeper level though, and actually assist clients with like accessing their own healing there and being curious is I think what led me to like be EMDR and driven to get more experience with thanatology and to thanatology, I like, so one of the textbooks for the exam, it's Death, Dying, Life and Living, and it's the core text. And I like how it says in the text, and I share this with clients, that yes, it's heavy, it's the study of death and dying, but then in like EMDR, we're holding in one hand death and dying, but in the other hand, life and living. And
Yeah.
it's also the study of life and living and how once somebody dies, do you honor yourself and them? So it's like, yes, we're talking about grief and sadness, but then we're also holding life and living. And what does that look like over time then that you have experienced this loss then?
Wow. I think that's incredible because in my corner of the universe, what I have noticed is a lot of people coming from different types of cultures and backgrounds and everything. Many of them don't have, all they know is the lost part and how
Mhm.
it's almost like they get stuck in the sadness and that the loved one has is no longer here, but there is no other pathway for them to go into, as you said, learning how to honor. And I think that that's just something amazing and incredible to even hear that, just losing someone is not the actual just end. It sounds like there is a way to what is it? I don't know if the appropriate word would be adapt or how to, live or move forward and or grow forward with the legacy of that individual while still honoring yourself. Um, I think one of the questions I have for you today, which I think is incredible, dealing with sibling loss, right? What would you say is unique, or what are some of the difficulties or complexities related to sibling loss that may be different from other types of losses, like a
Mhm.
parent or a pet, those
Mhm.
types of things?
Yeah, so we could on this question we could probably spend hours, but I'll give like the shorter version for listeners and just to pique curiosity. So if you did a lit review of sibling loss, there isn't a lot out there as compared to there's not a lot in the literature compared to child loss, parent loss, spouse or partner loss. So just acknowledging that. And then sibling loss, I want to say it's like under recognized, or even if you want to use the term disenfranchised. And David Kessler, the grief expert, speaks to this too, because and we're not saying it's wrong to focus on parent grief, or you wouldn't, but it's so sibling loss like tends to get minimized because one of the first questions people might ask are like, if you faced a sibling loss is, well, how are your parents? So that gets like your grief kind of gets pushed to the side a little bit, like, oh, are your parents okay? Not how are you, but are your parents okay? then the second question people typically ask, and David Kessler talks about like this measured compassion, because people, when they hear your sibling died, a common question is, oh, well, how close were you? So like how much compassion they give you is going to be measured by if you say we were really close or like it was very conflictual. So you might get like, again, like limited compassion if you were like, oh yeah, like we had so much conflict, but then not realizing that there could be, or what was the reason for that conflict, and oh, was there a reason, like a trauma history or environment where that prevented you from being close then, because that's another loss then, that you couldn't be close. Siblings, and I'm saying like it's common and typical, they're like the relationships we think and that assumptive belief are going to last our whole lives then. Like you also think like, oh, we're going to bury our parents together, or that person's going to be there to make decisions about our parents. So that, and it's again like shared traditions, even if it is a trauma history too, that's the person that knows exactly what went on in the household and shares that with you too. Again, shared birthdays, holidays, family occasions. Siblings typically in the adult world are who you socialize with too, and who you envision raising your kids together with too.
I
Wow.
think what you're saying is so powerful, Stephanie. I think as you're talking about sibling loss and these pieces, I think that shared and lived experience is so important. So for our listeners, the assumptive world is how you assume things will be in life, and this sort of the difference between anticipated and unanticipated death is more, we assume that our parents will grow old, we'll take care of them, or these ideas or things maybe that you expect could happen. And that's sort of this assumptive world idea. I think you said something really important about the literature review, and there being a gap in the literature. Was this something that was just kind of an area of interest, or did you look at the literature and find a gap and kind of try to fill it?
It was an area of interest from working in the grief and loss world. So I'm private with my clients and in general, but I guess I don't know if I'm going to use the word survivor of sibling loss, but I am a bereaved sibling though too. But so I want to say that my brother, he died 2004, but he would be very cringy now. Doing the podcast, he'd be like, okay, that's a little strange. But then, so in my training though, in my slides, I incorporate things about him that, and if you want to really speak to the power of the sibling relationship, so I have a twin sister, so she would probably be the only person in the world who could go through the slides and would see my brother in it though, but in a very private, subtle way. And she'd be like, oh, you put him in here. But she would be the only person that would know that. And then it would still honor that relationship, but also like respect privacy, and knowing that my brother would be like, oh, you're doing a training on sibling loss.
Do you feel like, and I think you're saying something very important here, that our personal experiences shape sort of these professional realms. And so I think that's really important to highlight. And I think we do have our personal flavor, right? I think Tamira and I were just talking earlier about people expect us as clinicians to not have grief, or or to be a certain way, outside of the office, and just normalizing that we are people and that we need to honor our own path and figure out, how to heal ourselves as we go through that process, right?
Yeah, I think that that is incredible. I think what you're sharing so layered. It's like that, onion layer, right? That
Mhm.
has so many different parts. And just kind of piggybacking on what Kathy was saying, in my gut, that was my hunch, right? Because when I asked the question of, what was it that made you lean into this pathway? And my thought was, I wondered, you know,
Mhm.
if there was something in her own story that connected with her to that. And I think that that's a powerful maybe for some people, uncomfortable yet powerful wisdom nugget, especially for new clinicians that are getting on that pathway and trying to figure out what is their therapeutic approach, what is their philosophy, and what is the lens and where is that coming from, as Kathy has shared with us, know your why, right? I know for me, being an EMDR therapist that is really honed in and very passionate about healing trauma, and more specifically childhood trauma and religious trauma, it was because of my own experiences. So I think that's powerful and maybe even anchors us, right, a bit. Doesn't it kind of anchor you to the commitment and the dedication and the growth as a clinician, as a professional who is serving people, because it resonates and you understand. It's like that quote unquote, I get you, I see you, I feel you, I understand, you know. Um, One of the questions I want to ask is, how do you marry EMDR with sibling loss? Like, what are uh, how does EMDR,
Mhm.
you know, address the challenges or those complexities related to sibling loss?
Mhm. I think EMDR, like, first it validates that this loss is heavy, hard, like it could be traumatic. It validates all of that. And then we're taking with EMDR, we're acknowledging the sibling loss and that it is under recognized, or there was reasons why maybe somebody couldn't grieve, or there's disenfranchised grief. And then we're taking the distressing part, or the worst part, if you will, if you're thinking of Shapiro's target sequencing, and then bringing down that distressor and clearing it out. So I'll use the example. I had a client who came in after a sibling loss, and she was like, there's no way this stuff isn't going to be distressing. She did talk therapy, like that for her wasn't helping, and but she did wanted it to be images from her sibling's death, her sister's death, to be less distressing. So I can use the example from this case is her sibling died in the hospital on a ventilator, and that image was, understandably very distressing, but it was just permeating every area of her life. Sleep, like driving, it would come in. And of course, she came in and she's like, there's no way this is never going to be a 10. But she was open to being curious and, okay, can we get your disturbance level down? And so she was kind of skeptical, but through like target sequencing and the power of the the past, present, and future prong, she was able to get her sons down to a 0. And she actually saw, so instead of, like, her sibling was still in the hospital bed, but then the image changed from being on a ventilator to there was like white lights around her sibling, and her sibling actually got up and walked out of the hospital room and was like free. And I'm not saying this happens for everybody, but this was like where the adaptive information went, where it was like, and her sibling was like, you have to live your life, like honor me, but you need to live your life. And this was somebody who was like, this is never going to be not distressing. And this was the adaptive angle. And we saw how her sibling, and yes, she's still sad, but it went from distressing and sad in one hand, and then we were able to move through to, okay, like, how do we're enhancing that relationship, which EMDR does. Then it enhances the relationship with the loved one, but then okay, now this is going to help me honor my sibling then by doing what my sibling said, like, you've got to move, go on with life then.
I think there's a whole spiritual component as well. I think everyone comes from various religious beliefs. I also am interested in the religious trauma component as well. And I think, as you're working on this, the difference between inhibited grieving and able to figure out how can you tolerate that. I think what you said, and reducing the SUD, I think the persistent complex bereavement disorder and the DSM, is that really a pathology? I haven't quite landed on a decision there, but I think that if we can call it inhibited grieving, I think what EMDR does is it takes that block out to allow us to resource the patient And if you think about what the sibling loss is, it's an attachment wound, right? And so if we're looking at it from an attachment perspective, EMDR can do so much relational healing if they can bring in a resource or a caregiving resource, and we do bilateral stimulation with a resource that could meet that need. I think is one way we could help clinicians understand how to work with the sibling loss, is to figure out what the unmet need is that they have in their life now, do resourcing with that, and then continue to give them a purpose for honoring the memory, sort of in our continuing bonds way.
I think if I am completely human and transparent, I mean, I think Kathy and I would probably agree in saying that so many amazing and delicious things happen during our interviews with the amazing guests like yourself, Stephanie. And for me, I almost came to tears, right? And as we say, triggered, but in a good way, with positive things because I'm noticing, right? I have an amazing client, even though grief, I didn't see it through the lens that you all are talking about and that Kathy has honed in on and is helping me to begin to see. Um, and I get a lot of clients that I wasn't aware that what they were dealing with was grief. I did not have language for it. And the reason why I almost came to tears is because I just had a session with one of my clients, and I mean, all this grief was now I know it was grief related to loss of her mother, and then sibling. I'm sitting here like, that's what it is. She's dealing with sibling loss and how you talked about the assumptions and just all these things. And now what's being activated for me is saying yes to that deeper dive and calling and honing my skills in that area because I get a lot of clients who are moving through this and they do have these thoughts when they come in, oh, this pain will never go away. You know, this is, they have this idea that they're always going to have to suffer, just with the pain related to the loss. Can you talk to us a little bit? Because I've experienced this. I did serve a mom, and this is probably another a conversation, right? A mom who suffered the loss of a newborn,
Mhm.
and she had the same idea. I will never be able to, but I didn't know what I was doing. I didn't know what I was doing in the context of grief and loss. I was just facilitating EMDR, which I think speaks to the beauty, the power, and the
Yes,
brilliance of
yes,
it, right? And we were able to get the SUD right down from where it was, which was like a 10, down to a 1, which we call ecologically adaptive, right? But can you speak to us a little bit about uh, maybe the stress that a client who suffers sibling loss when they come in, and then how EMDR can help them to reduce
Mhm.
that pain level and then that ecological state, because it is an actual loss, if that kind of makes sense. I know I probably said a lot, but
Mhm. No, I think that brings up like even like a good like a really good discussion point too. And even for Kathy's like her upcoming the grief, the advanced target training, it brings up a good discussion point for that because with EMDR too, we're not saying because a lot of people have come in and say, well, this is never going to not be distressing. And it's like the zero is that the actual image that they're bringing in is not distressing, not the death itself. So can they, because that could bring people, they're like, oh yeah, I don't see my person in death anymore, or I don't think about how they died, or I don't see like that car accident, or I don't see them suffering in the hospital. So that's a zero. The death might still be that they died and they're no longer here, could be distressing, but that image is no longer distressing then, is what the goal is. But also acknowledging too, like, and this David Kessler speaks about this too, that yes, like there's suffering, but how can we move through that to where from suffering to like we're helping you remember your loved one with more love than pain then. And that's the goal. And over time, and it's we're again holding like doing that two-hand interweave or end in both, or grief and loss, it's that dual process model of okay, yes, like there is this loss and we're acknowledging the heaviness and that's you are gonna your life that is you're gonna that is always gonna be there, but then also holding like how can you continue that relationship too and connect to yourself and your sibling too, and that reduces the disturbance level too, knowing like yes, they're not physically here, but I can continue my relationship with my sibling.
Yeah, I
That
think
is
one of
incredible.
the important points here is I went to a training, an Adlerian training one time, and they talked about the disenfranchised grief. So for our
Mhm.
listeners, those are the grief that isn't necessarily honored. And one of the participants was doing a practicum on the stage, and they talked about the loss of a miscarriage, right? And so when we have those kinds of losses as well, that's sometimes not recognized in the sibling grief realm, is it? You know, those, maybe it didn't result in a live birth, but I still have so many people that are impacted by the death of a miscarriage or a sibling, maybe not that didn't result in the live birth. I think, also too, I think I'm so excited about this topic because it's Memorial Day. And I
Mhm.
love doing these topics around Memorial Day and creating your own celebration around that. Of course, it's not necessarily just the time of year to do it, but it's when it's at the forefront, right, of our minds. And I'm just kind of fascinated by, you know, the idea of the non-live person, is lack of a physical presence that this person is grieving when they come to us. And I like what you said about just reducing the SUD. It doesn't mean that that attachment goes away. I think one of the important things and is that patients come in and they feel like if they resolve the distress and the suffering, that that relationship goes away. And I think they hold on to the pain because that's the only thing they can do to remember their loved one. And then our jobs is to facilitate that movement and to redirect their memories and thoughts to I can live and this pain isn't serving me, because we know it holds in our bodies. It can create all kinds of pathology. And so I think an assessment interview, asking them about any sort of miscarriages or deaths or ways that they experience grief or beliefs about if I resolve my grief, what does that mean? Because it's a part of me. I functioned like that for so long.
No, I think you, Kathy, and you bring up that point too about because like a miscarriage, a stillbirth, that's still a some it could still be somebody's sibling though, and also somebody that person is still a parent then.
Yeah.
So with even sibling or miscarriage or a stillbirth or a neonatal loss, we still talk to parents of how like oh these your children are still siblings, so how do you want to still tell them about their sibling, what happened in age appropriate ways, but we're still knowing that's they're still siblings regardless if they lived in utero or for a few days, that's still a sibling
I
relationship.
have a funny story here. So, you know, I have twin boys, they're 4 and a 7-year-old. And so, you know, this is very important information to pass down generationally. And here's my experience. So, you know, I have my daughter, I have a single birth, and so I get pregnant again. And, you know, I didn't know until I was 5 months along it was twins. And then I started, you know, looking at my genealogy, and my mom says, "Oh, your grandma miscarried a set of twins." I'm like, "Why didn't you tell me this?" You know? And so she had 7 live births, but 9 potential children. And so, you know, that's not necessarily talked of. It's just something that's mentioned. And I think that's also important too, you know, because, you know, I was in shock. I think even just this idea of grief, you know, you know, I wanted 1 baby and then I have 2 now, and how do I adjust my expectations and my bandwidth as well? I think it's not, it's just a shift. I think life changes and things that come up are also a shock, and how do we prepare for that? Now they're 4, and you know, it's just a journey as we move forward. But I think looking at, those maternal histories of miscarriage and those kinds of things can help share the family story and heal some of those generational traumas as well.
You ladies are brilliant. And I'm just sitting here trying to like, oh my goodness, it's almost like I wish we would have did this yesterday so that I would have had more wisdom and enlightenment. Exactly what Kathy was talking about. I also just want to say again, this is the beauty of number one, and I want to honor
Yes.
really the fact that this is the healer or the therapist who really has leaned into the healing and the healing pathway. And one of those healing pathways is, as we're talking about, EMDR. And what are we healing? Grief in relation to sibling loss, because there's many different types and forms of grief. Yesterday I was in a session, and when we're doing the history taking in
Yes.
EMDR, and this is a client that I served her last year, and I want to just say thank you to Dr. Francine Shapiro for this beautiful therapy model, because now we're able to tell our clients, their families, and our community, you're like a tree with many branches, and there are different life experiences that have been adverse that may have impacted and left some things, as Kathy
Yeah.
was saying, in the body. But EMDR is a powerful pathway that can help you find relief and freedom from some of those things. I've served this client before about her fear of driving that came out of nowhere.
Mhm.
Okay, now she's been an expert driver. I mean, she's the seasoned driver, in other words, okay? And then all of a sudden she's got this phobia and she couldn't even go to the grocery store. And her fiance was having, so we did some work. She got better. She got back driving. She comes back around, ladies, this year, and we're doing history taking. And I'm noticing that she's using the word trapped. Okay. And it's like, are you sure you've never been in a car accident before? No, I've never, trapped. Okay. And like a loss of control. What if something horrible happens? And then we end up with her remembering conversation with her mother, who lost her grandfather or her
Oh,
mom's dad in a tragic car accident when she was little.
okay.
Not to mention an aunt that also died in a car accident. And I'm in this session like, you can't make this up. Like, all right, okay, so is this, of course, a type of intergenerational trauma thing that's going
Yes.
on? Okay. And then all these things related to her mom, who is now passed on, started coming to surface. And I'm like, oh my God, but it wasn't, you all are giving me clarity that number one, this is all powerfully and in some sense, painfully connected. But that is why we're here, and that all this stuff really does make sense. She left the session, even though I
Yeah.
just, had limited information on what to say, and like, oh, okay. But she felt so validated and was like, okay, I'm not crazy. Okay, and this is coming from somewhere, and not that I'm just incompetent and losing myself. So I just, if you can just comment a little bit, either one of you ladies, just on how that works with that. I don't know, is it do we call it just intergenerational trauma, and how that can get passed on if you had a loved one who.
Yeah, I have a idea here. So the first point I want to talk about is phobia, and the second point I want to talk about is conscious and unconscious belief. So the patient, if you're working with phobias like this patient, there's an unconscious belief driving it. And I think sometimes we can do behavioral interventions to help expose them, exposure therapy. The important point here is that EMDR is not exposure therapy. And I
Mhm.
think people treat phobias with exposure. I think it's valid, but also where we're going here is now this, you're getting to the unconscious realm here. So the patient's now presenting, I have this phobia of driving. And then we do exposure and then they get through it. But really what's happening is we're not getting to the core of the limbic system in that memory. And so we're having in their conscious brain a presentation of symptomology that doesn't necessarily have a source. And so what we're doing in EMDR is we're treating that source in a network that is just be able to trace those traumas to other memories. And I think intergenerational trauma is very different, among people's brains. And so in this case, I would say, yes, it would be an intergenerational case, and that presented itself in an unconscious belief. Because what intergenerational trauma is it's stories you've heard about yourself, stories you've heard about your family or others. And so for her, this is just my case conceptualization, but for her, these unconscious beliefs have manifested at some point when her brain is ready to process them. So a lot of patients say, why now? And it's like your brain just had to work up the way to tell you it was ready, and you found this beautiful healer, Tamira, and your brain is ready, right? And so I think validating for her that it's just time versus, why. I think that's just where we're getting to, is this unconscious presentation of the phobias now at her forefront. And what is a phobic part? It's just a basic fear part taking over. So I talk about my bus analogy to where, in your bus, you have all of your parts, you name them, your angry part, your fearful, jealous, love, compassion, you have them all on the bus. And what happens with the phobia is that just takes over the bus. And so for my intervention, for my patients and the resourcing, I have them call out all of their parts and name them. And then we say, we're have phobia in the driver's seat. What I call it is fear. And then I encourage their right now self to tap that on the shoulder and say, excuse me, it's not your turn. So we do that intervention like I do with my children and say, it's not your turn. And then we have that person, the right now self, take control of that bus, right? And be able to take back that part. And then and this has generally always worked. I say, no, what's happening with that fear part or that phobic part? It's not happy, but it's sitting there. And then you're beginning to heal the nervous system so that the patient does understand that they're in charge, that this phobic part isn't ruling their life. And that's a resourcing intervention right there, that patients they can get it, and it just really helps them.
Just breathtaking and powerful. I don't know how you ladies feel, and I'm hoping that both the seasoned and the new clinicians, as well as just the regular everyday human being that comes across this conversation, it gives us hope.
Yeah.
And when Kathy was talking about resourcing, which I think is an incredible conversation that we also need to talk about, is there are things that we can empower and support our clients in learning to do where they don't feel so powerless and helpless in their life's journey, dealing with things that just seem to feel like they're taking over, you know. Um, One of the things that I wanted to ask you too, Stephanie, when it comes to the sibling loss and just some of the complexities, my heart goes out when you mention, and I'm so grateful. And I also want to say, and hopefully you can receive this, proud of you in bringing attention and awareness to the fact that siblings oftentimes are not acknowledged, or that compassion for them is also sometimes minimized. I think someone who's experienced that would really appreciate that, so I thank you for that. One of the things that came to my mind was, uh, what would you say is a resource, right? Like Kathy was talking about, that maybe you supported someone in who was dealing with sibling, and maybe they weren't very close, right? Or had some unfinished business with the sibling. Okay. What is a resource that you've facilitated with a client to help them?
So, and I like how Kathy brought up the resourcing, like that part of EMDR, which is my favorite part, and where I feel like, and I know the magic happens in reprocessing, but I was like, oh, it really happens in resourcing.
Right.
So I'm glad you brought up resourcing and the power of that, because in history taking and resourcing, we can just extend curiosity to, and this might be the first time we're doing with this with someone, is like, ooh, what happened where you couldn't be close to your sibling? And we're not being judgmental. And we're like, ooh, did something happen that maybe because your parents, like, it was easier if it was a traumatic home where siblings were separated or they were pitted against each other, or there's like that story that you're told where you feel different, like, oh, your brother's smart and you're the one that's like an airhead, or you're the creative one, and that kept you distance. So we're just being curious of why there was distance, and maybe it is just temperaments though, but that is a loss because people are like, ooh, when we were adults and matured, maybe we would have been closer together, and honoring that. And then resourcing, we're being curious of what was your happy moments with your siblings. In abusive homes, it could be, right, like, did your sibling protect you, or were you the protector then? Did you hide in the closet together? And just acknowledging that. And then, is there a way over time, and just extending curiosity and resourcing, because this has been through reprocessing, this is going to become stronger, is there a way you want to honor your sibling? And just throwing some ideas out there, like maybe it's a motorcycle rally or a scholarship fund or eating their favorite meal. And we're just opening that dialogue up, because and then what I've seen through experience is that EMDR helps them get to how they're going to honor their sibling then, which takes that suds. Once they continue that bond or find a way, it's going to take that suds right down then.
I have something really powerful. It's a whole nother conversation, but I want to briefly touch on this. So when I worked at Child Protection, they were always focused on keeping siblings together, and this other type of disenfranchised grief, if we're assuming that there wants to be a bond, but also too, sometimes there can't be a bond because the sibling is the perpetrator, or even in foster families where one foster family wants one sibling but not the other. And so I think sometimes in these cases, in foster care, there's a huge need for this sibling delivery of care, specifically because they're trying to get them together, but sometimes there's issues where they can't be together, or that maybe the parent favored one, or sometimes the foster family will just take the additional child because they want the one, which is a story I just recently heard. And so those beliefs about yourself, I'm not worth it, I don't matter, my sibling's more important, or, I am not safe with this sibling, those kinds of issues. So I think in reference to my experience in the foster care system, those are issues we dealt with all the time.
Yeah, I think you're right. Like, that's where resourcing, you're going to extend curiosity. You're right. Like, was there a perpetrator imitating part, or like you felt close, but that was your abuser too, or there was a reason like foster care couldn't take both of you then.
Yes.
Wow. I just think I celebrate both of you all, and just want to say that that's why we're here at Journey Through the Eyes, right? We're here for the journey. And I thank both you and Kathy for speaking in behalf of the human beings and just that population of people who have gone through those experiences in foster care. And I think you're right, Kathy, that is a whole nother conversation. We want to support both the clinicians and our communities in helping them to understand, right, that they're not alone. And there is a pathway of healing, growth, and moving beyond the pain, as both of you have talked about on today. And so, Stephanie, you are extraordinary. Okay.
Yes, we celebrate you.
Mhm. This has been a powerful conversation. And before we wrap up, right, for the day, do you have anything you want to say, Stephanie? Any words of wisdom or encouragement you want to say either to a clinician or to just the community overall?
No, thank you for having me here today. Like, honored to spend time with both of you.
Mhm.
Uh, I would say, like, to advice for all, which I some need to heed too, is to find your people in your community within, like, if it's your EMDR people or your EMDR grief and loss people or your maternal mental health community, find your people and connect with them, and laugh with them too, use them as sounding boards, but Find your people, because that's gonna help us strengthen our work, but then also reduce burnout and remind us of why we're doing this work too.
I want to also acknowledge that Stephanie is an amazing person, you know, instructor, leader, healer. And so just encouraging you to find her. Her training is posted on Pessy for the sibling loss training. She's going to have a book coming out with it. And so she's just also amazing and so humble. So we celebrate you and your contribution to my life personally and to the field. You're just a real gem. You don't find people like you very often. So I'm just super grateful. And it's stephaniepearcetherapy.com is your website. Is that correct?
Yes.
So that's where you can find Stephanie's for anything maternal, sibling, those kinds of things as well. And she has a mailing list, which she promises not to spam you. So
I think it's incredible. Well, we've had a very enlightening, very heartfelt conversation today. Just the presence here, even online, is incredible. I know I'm uh, both feel encouraged and things have been activated, inspired for me. And so now, Kathy, I want to hand this hot conversation over to you and tell us a little bit about what's going on with Rewired 360 University. And don't forget to encourage them to subscribe.
yeah, so we have group consultations that we're going to offer. So if you want to work with a patient on grief and loss, we have those coming up this summer. We're going to open up our certification and consultation programs as well. So you can work with us to be able to become, follow that career path that sometimes can feel unattainable. We have our grief and loss targets training as well, and a documentation training, and Stephanie's training with myself. And we just want to encourage you and let you know that you matter. You can find all of our resources at rewired360.com. We see you, we're with you, you're not alone. And we wish you a great Memorial Day, and don't forget to celebrate yourself.
Amazing. Thank you all so much for tuning in. Have a wonderful weekend. Take care of you so you can take care of others. Have a great day.